As we open this session, we are going to pray. But before we pray, I want to say that this season, we have been operating on the topic running to win. We have been discussing about running to win. And as we think about running to win, we have been following this writer of the New Testament. 70% of the letters in the New Testament were written by him. His name is Paul. The name of this man we have been thinking about his thought line is Paul. And we have been following the words of Paul as he writes in Hebrews chapter number 12. In Hebrews chapter number 12, the Apostle Paul looks at every challenge in life as a way of, as a race. Every challenge he talks as if it's a race. And so with that mindset, we have always concentrated on the mind of Saul at this time of challenge of COVID-19. So we have been talking about running to win. Let me welcome you in this session by maybe reading 2 verses from the scripture, then I pray. Paul in Hebrews chapter number 12, verse 1 to 3, he says these words. I'm reading the scripture now, members. Paul says, therefore, since we are surrounded by such a great cloud of witnesses, let us throw off everything that hinders us and sin that so easily entangles, and let us run with perseverance the race marked out for us. Verse 2, he says, let us fix our eyes on Jesus, the author and the perfecter of our faith, who for the joy set before him endured the cross, scorning its shame, and sat down at the right hand of the throne of God. Verse 3, he says, consider him who endured such opposition from sinful men, so that we will not grow weary and lose heart. In these 3 verses, members, I want to remind you that Paul brings up a thought line that believes that for him to run to win, for we to run this war, there are 3 things that we must keep in mind. He says, you must run light, you must run focused, and you must run with endurance. To deal with any problem, Paul suggests that you must run light. Running light, he said, you must lay aside every weight and sin. You deal with the sin, and then you will win. And number 2, he said, you must be focused. You all know focus. Sometimes we say focused means follow one course until success. And so he said, you must be focused. Keep your eyes fixed on the goal. And we in current parish, we come from a thought line that says, you know what? You must do something. Spirituality is not a reason for irresponsible behavior. Whereas we are spiritual, we must do some specific things the right way. And so Paul says the same thing. We must do something that keep our eyes focused on the goal.
And now it's my great pleasure to introduce our host speaker, Dr. Daniel Gikonyo. I've known Dr. Gikonyo since our high school days in Kagumo. We also work very, very closely with him at Current Hospital, where he's the chief cardiologist. He refers his patients to me before major heart surgeries can be performed, because as a protocol for cardiac surgeries, nobody should have cardiac operation before he has got good oral health. So once he refers the patients to me, I usually do proper examination. I check the mouth, all the soft tissues in the mouth, the tongue, the inner lining of the mouth, what we call buccal mucosa. I check the palate, I check the throat, because there are some microorganisms, bacteria in particular, which reside in the oral cavity and can lead to very severe infections in the heart, what we call infective endocarditis, rheumatic heart failure, and can make the outcomes of the heart surgery unfavorable. So we usually do evaluation on the dental health of our patients. I would like now to welcome Dr. Gikonyo to present his topic on COVID-19 in relationship to non-communicable diseases. And at the same time, I would like also to give him an opportunity to tell us about current hospital, the services available, and how majority of our congregants can benefit from our hospital, current hospital. Please join me in welcoming Dr. Ikonyo. Dr. Ikonyo, welcome.
Thank you very much, Dr. Momenya. It's always a pleasure and a privilege to be associated with you and also to be associated with the current community. As you are aware, all the participants, Karen Hospital is our neighborhood hospital for the community in Karen that is located on Langata Road. Our topic today will be COVID disease mainly, but we shall also find out how COVID is related to the already existing non-communicable diseases. The current hospital opened its doors in the year 2006 when it was launched by none other by the third president of the country at that time, Honorable Moi Kibaki, in June 2006. The opening is what most people talk about, is what you see in the media, but the main foundation before even the hospital was built was laid down by none other than the very Reverend Dr. George Wanjao on the 31st of March 2006. Reverend Wanjao has been part of our life as our family. Me and Dr. Ikonyo. He's one who actually, unknown to you, is one who married us in the St. Andrew's Church on the 29th of June, 1974. And we have been together ever since. He's our spiritual instructor and has been close to us. It was an honor to have Reverend George Wanjao come and lay the foundation stone for the hospital. As you can see, our families are knit together. Reverend Wanjao and his wife occasionally come to visit us at the current hospital. You can see Dr. Betty Ikonyo on the right there, and Dr. Anthony Ikonyo in next to the Reverend, and Juliet Ikonyo Nyaga on the extreme left, who is the new chief executive of the current hospital. Dr. Betty Ikonyo is now the chairman of the board. As you can see there again, my good friend and Reverend George Wanjao, who, as I said, is our spiritual father. But again, we take a recognition of a man called James Kamunge, who was our high school principal when we were in Kaguma High School with Dr. Momenya. The current hospital is not just a hospital, it's a system. But allow me to say that the current hospital system, which incorporates the main hospital on Langata Road, we now have a nursing school at the main hospital for the last 5 years. And we have graduated 5 classes of nurses, registered nurses. The nursing school also has now been upgraded, become a partial medical training school. We are training cardiac technologists in various aspects of cardiac care. And we are soon going to upgrade and train intensive care nurses and other cadres of healthcare. The current hospital also is a training center for medical interns from the Ministry of Health. And we are also associated with the Society of the Surgeons for East and Central Africa, and we are training their surgeons. The current hospital also has a corporate responsibility association with Heart Foundation, which is our corporate responsibility, social responsibility arm, where we assist children who are born with heart diseases or who acquire heart diseases in their early childhood to afford and access medical surgery to correct the defects of their heart. Many of us have participated in the Heart Foundation dinners and Heart Foundation walks. The current hospital is not only in Karen. We do have now what we call satellites or outpatient branches in Nakuru, in Naivasha, in the CBD Nairobi, downtown, in the Cardinal Tuga building, We are also in Nyeri, in Karatina, in Thika, in Rongai, in Meru, and in the main hospital. These are services that we offer to the populations that are around those regions. Today, let's talk about COVID-19, which is a new epidemic that has hit not only our country, but the world at large. For a long time, we were happy that we are controlling the infectious diseases like HIV, tuberculosis, malaria, pneumonia, chest infections, and such, and we thought we were winning. Until now, we are in a new crisis with COVID-19, and has come at a time when other non-communicable diseases like high blood pressure, hypertension that is, diabetes, heart attack, and stroke and cancers have also become a major health crisis. So we are caught in between these two major epidemics, and we are finding out how we can get out of it. The COVID-19, I will not go into the word because everyone now knows what COVID-19 is. It's a coronavirus infection that started last year, hence the name 19, that started in China and has spread to all corners of the world. It's a very highly infectious disease caused by this recently discovered coronavirus. This virus was unknown before 2019, but now everybody in the world knows about it. It's a crisis. As of today, there are over 24,411 cases in our country, and today we have added an extra 671. Though many have recovered, we have had the misfortune of having 399 deaths, and 3 have been added today, making it 402 countrywide. And these are the ones that we know. There may be others that we do not know. In the whole world, it's worse than that. There are over 19 million cases worldwide, some of whom have recovered, but there is over 712,000 deaths in the world, and 6,000 today have died. You can add them to that list. It's very important that we know the symptoms of this disease so that we know when to suspect that we may be having it, or when our neighbor or our friend is having it. There are 3 main symptoms that we know by now. One is cough, high temperature, we call it fever, shortness of breath. The cough is like continuous. The shortness of breath comes with tiredness, fatigue, and muscle aches. One may experience congestion in the nose or running nose. Headaches are very common, as are sore throats. There are less known symptoms, but the most cardinal that we should worry about is if you have a loss of taste or smell, because that means the virus is already affecting our nerves. There is also a virus affecting the gastrointestinal system, presented with nausea and vomiting and diarrhea. All these may occur in isolation or in groups, but if you have any of those continuous symptoms in the current day and age, you should suspect yourself as having had COVID infection. Although COVID is mainly a respiratory disease causing cough, shortness of breath, it is now known that the major cause of death in this disease is not even respiratory. The virus, when it goes into the body, it attaches itself to a receptor called the ACE2. This may be too deep medicine for most of us, so I'll not go deep into it. I'll just pass it by the way. Notice that there is a receptor in our systems that receives the virus and as it enters the body. These receptors vary between people, And therefore, some of us are more prone to this infection than others. The more ACE2 receptors you have, the more you will be able to receive and entertain the virus in the body. Once the virus enters the body, not only does it damage the lungs, but it spreads to involve other areas. And it causes what we call a systemic inflammatory response syndrome. That means it lights a fire in the whole body and the whole body starts burning. That's what we call inflammation. This systemic response is the one that gives you a high fever, gives you a high heart rate, makes you breathe faster because you cannot breathe anymore, raises white blood cells as they try to fight the infection. And as it gets worse, then it causes more symptoms all over the body. Whereas the infection starts in the lungs, the effect of the inflammatory response goes to all organs. The kidneys, you may go into kidney failure. The heart, it causes heart attacks. The brain, it might cause a stroke. And even in the gastrointestinal system, where it causes poor absorption and poor digestion. So whatever starts in the lung now spreads through the whole blood system, causing inflammation of the blood vessels all over the body. The blood starts clotting in these little blood vessels, and all organs are damaged and they suffer loss of blood supply. That is why most people die from the COVID infection as it spreads through the body. It's important to know what one should do if you have these symptoms we have talked about, or if you have had a test of COVID and has come back positive. If you have had a COVID test positive, or you have any of these symptoms, or you suspect you may have the disease, please stay at home. We used to say 14 days before, but now the studies have shown that you can actually stay at home for 10 days. After 10 days, the way that we shed the virus is now known that you are no longer infective. But those 10 days to 14 days, stay calm, don't panic. Make sure you have family members near you just in case you get more sicker. Keep yourself in contact to people on telephone, but please don't go to work. Don't use public transport because you spread the virus. Don't go to public places. Send somebody else to do shopping for you. Don't go visit your relatives. Do not have visitors in your house. And don't leave your house unless you are going for more medical care. So if you know you have COVID-19, separate yourself from the people in your home. As you self-isolate in your house, make sure that you use a separate bathroom from the others. Stay away from your family members. Please wear masks all the time and clean your hands with soap and water as often as possible. This is for people who are isolating. But the wearing of masks, the cleaning of hands, staying away from people at a distance of 1 meter, 1.5 meters is for everybody to avoid either spreading it or catching it from other people. You have heard of people talking about isolation and quarantine. Isolation is what we have said you keep away once you are known to have had the virus or you have symptoms. Quarantine is when you have been exposed, but you're not yet sick, is what you do. That is what we call quarantine, when you do those things away from people if you are suspicious. But if you are confirmed or you have symptoms, we call that isolation. When you say you have been exposed to a close contact, it's when you have come face to face with a person who is confirmed to have the disease, and you have been with that person within less than 1 meter for more than 15 minutes, and you are not wearing masks. For example, if you have been in a place not wearing a mask, you have been with somebody for more than 15 minutes, you have been close less than 1 meter, and then you hear that person has been confirmed COVID, then we classify you as a very close contact and you must go into isolation and self-quarantine. The reason we're having this talk today is partly to let you know what COVID-19 looks like, how it presents, how you can protect yourself. But it's very important to know who is at great risk. And the people at great risks are like me and Dr. Mumenya, those who are over 60 years. I suspect many of us listening today are in that category, but much more so those of us who are overweight. People with high blood pressure are at higher risk of having complications of COVID than the average person. People who have the sugar disease, diabetes mellitus, also have a higher risk of complications and have a higher mortality or death rate from this disease. So are people with chronic kidney disease, people with heart or lung disease, people with cancer, people with HIV, or people with tuberculosis. Let me show you the seriousness of these comorbidities. How serious it is to have COVID when you already have another disease. Start with the one at the very right side head here that has 10.5% mortality or death rate, people with cardiovascular disease. That means people in heart failure, people who have coronary artery disease, and people with other forms of heart disease have a very high risk of dying from COVID infection if they get it. Those of us who have diabetes mellitus, the sugar problem, have a 7.3% risk of dying if you get COVID. People with chronic respiratory disease equally have a higher risk as people with hypertension, people with cancer. You can see these rates are all above 4%, but people who have no pre-existing conditions, although they may die from COVID, the risk is much less. It's less than 1%. That is why mortality or death rate in young children or young people who have none of these comorbid conditions don't have a high mortality rate. So if you're in this group, you're lucky, but if you're in this group like some of us, please, let's protect ourselves from getting COVID because we get the most serious complications. So if you have any of those underlying medical conditions you have mentioned, high blood pressure, diabetes, make sure that those conditions are well controlled. Because the mortality is not only high because you have those conditions, but higher if you are not taking your medicines regularly, your blood pressure is not well controlled, the diabetes is not well controlled, the risk is higher. So monitor your blood pressure, monitor your blood sugar, get a home device like this one that measures blood sugar to know that your sugar is well controlled. If even these home monitoring gadgets for blood pressure are available. And these days, if you can get access to it, get what we call a pulse oximeter. A pulse oximeter measures the amount of oxygen in the blood. This is an easy to use device which measures the oxygen saturation in the blood and helps you to identify early when you are in need of medical attention. Normally, our oxygen saturation in our blood should be higher than 92 all the way up to 100. If your oxygen saturation starts to fall below 92, then you are at a very high risk and you must, and I repeat, must seek medical care. Other things that we know are helping in the recovery from COVID is healthy meals, plenty of water, good rest, sleeping well, but no smoking. There is data that vitamin D, which you can get in the sun, if you sit out the sun, appears to be of use. Some zinc supplements, vitamin B, which all you can get from good, balanced diet and sunshine are useful. So stay healthy and live healthy. There are medications that have been said to be useful. One of them is steroids, medicine like dexamethasone, and we know they are useful, but they are useful for people who are sick in hospitals. Do not take steroids at home just because you have a small fever or because you have had contact with COVID. There is a lot of debate about hydroxychloroquine. There are some data that suggest maybe it may be useful early. Start your video. Are you okay?
We've lost you, DK.
I think so. That's what I noticed.
Yeah.
So
Okay, carry on.
trying to come back. Am I back now?
Yeah.
Am I back now? Dr. Menya?
Yes, you are. Carry on.
Okay, thank you. So do not take steroids unless you are in hospital. Hydroxychloroquine has been talked about, but we don't have enough data to say that is much useful. But for those in hospital, there are medicines that we are using that we have found to be useful. One of them is high-dose steroids. Antibiotics protect from secondary infection, and blood thinners called anticoagulants that stop clogging of blood vessels. It's very important that if you are isolating or quarantining at home, if your symptoms are worsening or you're not improving, please seek medical help. If you notice that somebody who has COVID with you is getting confused or having difficulties concentrating, that means they have symptoms of neurological involvement, please seek medical attention. If the fever is not going down, if you develop chest pain, if your blood sugars are going higher and higher, if your breathing is becoming more difficult, and you are taking more than 25 breaths in a minute, if your oxygen level, if you have a pulse oximeter in the house, drops below 92, please seek medical attention. Don't stay at home self-isolating if you are developing worse symptoms and you're not getting better. You must please go to hospital. But for prevention, masks for everybody. But don't lose hope. Let me take you back to Genesis 1, verse 26. And it reads, and God said, let us make man in our image, after our likeness, and let them have dominion over the fish of the sea, and over the fowl of the air, and over the cattle, and over all the earth, and over every creeping thing that creepeth upon the earth. So the good Lord made us and gave us dominion over all these things, including the things that creepeth upon the earth, which I think refers to the viruses, including COVID-19. So we shall overcome by the grace of God. In 1889 to 1890, over the world, there was another pandemic like this called the Asiatic or the Russian flu. And over 1 million people died. And if you imagine 1 million people in 1890, one, maybe they didn't count everybody. Two, the population was not as high as today. So percentage-wise, a lot of people died from the Russian flu in 1889. The one that is known to have been most serious in humanity, in the history of humankind, was the Spanish flu. That was during the First World War, and the Spanish flu killed more people than died in fighting in the World War, 50 million people. In our lifetime, 1957, there was the Asian flu that killed about 2 million people. It was followed by the Hong Kong flu And again, the Russian flu made its way back about 100 years later. We have had the swine flu in the year 2009, and now we have the COVID-19. But as you can see, all these pandemics were severe, they came and they left. Like all infections, mankind always overcomes. Remember the smallpox infection. Smallpox was very prevalent in the 1920s and 1930s. But over time, as a human being have progressed in knowledge and with immunization, smallpox is today almost non-existent in the world. Human society, through the grace of God, has overcome as we were promised. HIV came in the 90s, became very prevalent in the mid-90s, and over time, the prevalence of HIV in the world and also in our country is falling. We have medications that keep people with HIV alive, and vaccines is still far away, but it's being worked on. But as you can see, the HIV pandemic came, and like God promised, we have dominion over the virus, and we overcame. Let's go to those lifestyle diseases we mentioned that raise or increase the risk of dying from COVID-19. And these lifestyle diseases, the chronic, non-communicable diseases and some communicable, are with us. They cause heart attacks, cancer, diabetes, strokes, HIV, accidents, and chronic respiratory diseases. These, all of them, both infections, accidents, heart attacks, are all lifestyle. Even road traffic accidents are lifestyle. As you have noticed, in many hospitals today, the number of people coming with road traffic accidents has dramatically reduced during this lockdown because consumption of alcohol in pubs is less. There is a curfew after 9, so night travel is less. Road traffic accidents have reduced. It is lifestyle. Let me talk about heart disease, because as you noticed, it is the one of the comorbidities that causes high mortality in people who get infected by the COVID virus. Heart disease has been increasing in our country, Kenya. 30, 40 years ago, we rarely had Africans of African descent in this country having heart disease in the way we know them as heart disease that causes heart attacks. Heart attack, Reverend Kanga, if I mention a little, is a disease that is caused by blockage of these little blood vessels that feed the heart. This is the heart. And in reality, size of the heart is about this level. And it sits in the middle of our chest towards the left side. And if you look at the surface of the heart, you'll notice it has tiny little blood vessels that feed the heart. We call these vessels the coronary arteries. And over time, whereas they are usually very open, they start forming some deposits. It's like rust in a pipe. And as the blood vessels rust and deposit this material on the inside, which is cholesterol, they will eventually block. And when they block, the area where the vessel was taking blood does not occur, and that area gets damaged. That is what we call a heart attack. In cross-section, this area is an area of normal blood vessel, where we are in our first decade and our second decade. But as we grow older, from the age 25 onwards, the vessels start aging, and we start depositing all this cholesterol material and other debris on our vessels that compromises the diameter of the blood vessel and makes the blood to clot and cause heart attacks. Coronary artery disease develops very slowly over decades. And most of us don't know we have it until the disease is very advanced. The early symptoms is chest pain, shortness of breath, before you get a full-blown heart attack. So although we are talking about COVID, let me leave a little message here that all of us who are over the age of 45, if you become short of breath, you have a bit of chest pain, don't stay at home to nurse that pain. Of course, current time, this could be from COVID, but more often in the non-COVID days and after the COVID is gone, this is from impaired blood flow in your heart that could lead to a heart attack. So if you get chest pain and shortness of breath, please seek medical advice and make sure you reach the hospital before 6 hours. Because those 6 golden hours, doctors are able to unblock the vessel and restore blood flow to the heart, and you can be saved from getting the heart attack. If you get that type of heart pain and you're at home, please take a single tablet of aspirin before you even come to the hospital. These comorbidities that are causing mortality or high death rate in COVID are known. And they are products of cigarette smoking. They are products of a high cholesterol in the blood. They are products of a high blood pressure. They are products of diabetes, excess body weight, and all these things, as you can see, are lifestyle. It's what we eat, it's how much exercise we do, it's what we weigh. Of course, there are areas that cause cardiovascular disease that we have no control of because it can be running in one's family. And that we just say is shauri ya Mungu. But on this side, these things are modifiable and they are within our power to change them. And we can change them by avoiding having what we call the metabolic syndrome. And all of you listening, if you have time, take a tape measure and measure your waist at the region of the navel. If you are a man and your tummy is more than 40 inches or 1 or 2 centimeters, you are already going to the metabolic syndrome and you have a high risk of getting heart disease, stroke, and also dying from COVID if you get it. So keep your circumference of your tummy less than 40 inches, 1 or 2 centimeters for men, 35 inches or 88 for women. Make sure that you get a cholesterol once in a while and keep your cholesterol low and keep your blood pressure below 130 by 85 and our blood sugar less than 6.1 millimoles per liter. Because those are the things that cause cardiovascular disease. And cardiovascular disease now is the leading cause of death in the world, even in the time of COVID. 85% of the global cardiovascular burden, unfortunately, is in the middle income countries where Kenya is included. And non-communicable diseases, they cause 60% of all the deaths in the world. And they carry 43% of the global burden of disease in the world. These diseases include the cardiovascular diseases, cancer, respiratory disease, digestive diseases, diarrheal diseases, diabetes, liver disease. But look at the #1 cause of death in the world is cardiovascular disease, and it's still the #1 cause of death in people who have COVID infection. So make sure that blood pressure is well controlled all the time, that it is less than 140 by 90. Make sure that you check blood sugar, because if you have diabetes or kidney disease, then even low blood pressures as low as 130 become more serious, and they should be controlled more in people with diabetes and kidney disease. Unfortunately, these diseases in our country are increasing over time. You can see this graph showing how blood pressure over time has gradually grown from the 80s to the turn of the 2000s. So we are gradually getting higher and higher blood pressure in society. We are gradually getting more diabetes. Diabetes has become also an epidemic, It is the major cause of kidney disease. 3/4 of people going for dialysis have diabetes. Many people who are losing their limbs by amputations have diabetes. Cataracts and eye blindness are also results of diabetes. So is heart disease and strokes. And diabetes remains a major cause of high expenditure on our national health budget. Diabetes, ladies and gentlemen, brothers and sisters, diabetes is a controllable disease. And these complications we have mentioned are not from diabetes, they are from diabetes that is not well controlled. Over time, WHO data shows that even blood sugar is increasing, both men and women in our country for the last 40 years. We are continuing to have more and more blood sugar. Diabetes is growing all over the world and is associated with an increased body weight. Combine that with heart disease, diabetes will cause more mortality. I will not talk much more about respiratory diseases because I know that most of the people who are listening here do not smoke. However, there is smoke out there in the air from environmental pollution, from smoke from cars and smoke from burning of carbon. Cigarette smoking remains a major threat in society, not in the people who are listening, I hope, because I don't expect any intelligent person today to be smoking cigarettes with all the available data in the world. Cigarettes are poisonous. They contain many, many toxic chemicals, including formaldehyde that we use to preserve bodies in mortuaries. It has carbon monoxide. It has mercury and lead, and all these ingredients cause major health risks when they are inhaled. Cigarette smoking is a major cause of heart disease, lung cancer, early death. It increases the risk of hypertension. It increases the risk of peripheral artery disease, causing gangrene and limb amputations. But in the current day of COVID, it increases mortality when one gets infected. But much worse for men, cigarette smoking is one of the major causes of impotence and fertility problems in men. Let's take care of our weight. When you are over 20% or more than your expected body weight, we say you are obese. You have heard of body mass index, which is the weight in kilograms divided by your height in meters squared. It gives an idea of how obese one is. But this, you do not have to measure yourself to know you are overweight. You already know. You can guess by just taking the circumference of your tummy. You can tell when that one has gone beyond the numbers we talked about. But even we as doctors, we can tell when you are overweight. We just wait to see as you come into the clinic. And as you come through the door, we look at what part of your body comes in first. If your tummy comes in first, I can tell you you are obese and overweight and you need to lose weight. The body mass index should be between 18 and 24. But there are some of us who are above 30 and 40 who are obese, and there are answers to that. The body mass index has increased over time in our country in the last 40 years. Because this is what we keep on eating, this type of food that our children like. They have a word called yummy and yucky. They're supposed to be yummy, may I call it yucky? Let us teach children to eat healthy food from the beginning. And that's why we have a wellness and preventive medicine in current hospital. We want you not to come to hospital, and we have a wellness and preventive clinic on the ground floor as you enter the door so that you don't have to enter into the main hospital. We want you to be protected from disease, and that will be our main goal. We want to address the people who are healthy than address those who are sick. After all, there is more healthy people who are not sick who we can address to than the people who are sick. When you come at the Karen Hospital for Wellness, we do a risk assessment of your health based on the history and physical exam. We do give nutritional assessment and recommendations. We do targeted screening for illness and prevention. And Dr. Mamanya would say, and he knows, we do dental screening and advice, and we do eye check and advice. We talk to people about healthy diet, not to smoke, have your blood pressure checked, and if it's high, have it controlled and take medications for life. Check the blood cholesterol, and if it's high, diet and medications. Lose weight by being more active. Walk as often as you are able. And even here at the Karen Hospital, we have a notice at the entrance of the elevator saying, remember, it's healthier to walk. After all, you take an elevator upstairs to the doctor's office just to go and sit down and wait for the doctor. Any place where there is an elevator, let's have those closed except for people with disability so that people can walk up the stairs as much as possible to lose weight, control their sugar, and reduce their blood pressure. And blood pressure these days, we have home gadgets that can measure blood pressure, and you're able to control your pressure to below 130 and 80. Cholesterol is partly diet and partly family, but where it is high, diet control is first, after which we can take medications called statins. So when you come to Karen Hospital, we do our health screen, we check your blood pressure, we check your blood sugar, we take your weight and check your BMI and advise you how to do, what to do to reduce your weight, mainly by diet and exercise. Diabetes is easy to measure because you can do a blood sugar even at home. There are new gadgets, and if the sugar is high, we can control it. We do have cancer screening, both for men and women. For women, we screen for breast cancer with mammograms and also with physical examination and sometimes ultrasound. For men, for women, we also screen for cancer of the cervix, which also is very common. And remember that cancer of the cervix is also preventable by immunization in young people, immunizing against the human papilloma virus. Ovarian cancer can be detected early by using ultrasound. Colon and gastric cancer, especially for us over the age of 45, can be detected and controlled with endoscopy and colonoscopy, and those are things that are available and should be used by those of us over the age of 50, some of us who are listening. I will not talk about cancer of the lung because many of us don't smoke, have never smoked, and teach against smoking. And I don't believe any smoker would qualify to listen to this talk because it's only for very intelligent people. Prostate cancer for men is easily diagnosed by symptoms, but also by ultrasound and also by a test we call P.C.E.A, prostatic specific antigen that rises as the cancer takes hold of the prostate. Do this once a year if you are the age of 50 and have a physical exam or an ultrasound of the prostate every year. Prostate cancer detected early is curable. Immunizations are useful for pneumonia, for hepatitis, and for human papillomavirus that causes cancer of the cervix. For those of us with chronic illnesses like diabetes, heart disease, chronic lung airway disease, we should take a flu vaccine every year and a pneumonia vaccine once in a lifetime. So these packages are available. I'm not going to talk too much about them because many of us know about them. We grade depending on what you require. We could have a bronze checkup, a silver checkup, or depending on the risk factors, we can even go up to a platinum checkup for people who are over the age of 50, 60, who have issues of high blood pressure, diabetes, or cancer or heart disease. You can just come for a heart check that checks only your electrocardiogram, an echo, and exercise stress test. Let me stress this because many of us are dropping very quickly without warning from heart disease. Heart disease are not only preventable, but they are predictable. So if you're over the age of 50 or 60, once in a year or two, please come have your heart checked. And if there's an issue, there are medications we can give you to control or reduce the risk of having a heart attack. But don't feel so discouraged because God said, let us make man in our image, after our likeness. And let man have dominion over the fish of the sea, over the fowl of the air, and over the cattle, and over all the earth, and over every creeping thing that creepeth upon the earth. We have dominion, we shall overcome, we can conquer. Thank you very much.
Amen.
Back to you, Dr. Mamenya.
Thank you very much, Dan. You have taken us through in a very simple manner. We've understood all those medical conditions, and we really appreciate your health talk. We have learned a lot from you, and we hope that everybody who is participating in this webinar will benefit from that talk. Thank you very much.